and one or two questions you can say they were tricky if the topic was not given even one glance. This is November gone, we have December and January. 2 months to go before the exam where we are going to see competition. If we are from North India, winter is coming. And if you are from South India, winter will never come. If you are from western part of India, winter is coming. If you are from eastern part of India, winter you can, little bit winter you can see. So this was the first question which I have been provided. It's a very old question. It has been asked since I have started preparation. 1.5 decade back. And the same question is being asked. So this shows that the examiners are also less interested in making a good paper. Most of the questions are repeat. There was thing new, which shows the examiners are not interested in making a good paper, or they have been paid very less to make questions, or there was no one to make questions and someone has just made one paper for himself and put it for the whole students. And so, but yes, because the points which I'm going to cover in this question, they are likely to be asked if someone is making a new paper. This is the old standard question. A 3-year-old kid delayed milestones, playing with herself, not making friends, shows difficulty in learning, delayed developmental changes as compared to normal child, speech, memory, cognition. You know? So there are some delayed development, child is playing with herself and all that. It's a standard question, standard answer, autism. Right? We all know about the answer autism. Fine. But the important part of this thing is the important part of this question comes with the new things which might be asked from this question. Let's cover them one by one, because a couple of years back a question was asked which the kid was have difficulty in swallowing the paper, the food. So the autism has other issues with the kid. Remember this, it's a new term which we can use for that also. Autism is always unique, totally interesting, sometimes mysterious. A new word, autism. That is A for autism, A for always, U for unique, T for totally interesting, and SN for sometimes mysterious, right? It is an incapacitating disturbance of mental and emotional. Remember this, there are motor functions are normal. Note the motor function in autistic child remains normal. Motor functions are not affected. It was a question in 2011, so much of controversy was there. But in autism, the motor functions remains normal, right? Mostly this defect is seen within the first 3 years of life. It is quite difficult to diagnose and there is no cure, right? It is difficult to diagnose and no cure. Previously, it was thought to be caused by emotional disability and all that, but the current thing, or they have said that neurological and all that, but the current concept says that it is caused by a physical disorder of the brain. It is a physical disorder of the brain, right? The prevalence is 6 per 1000. The prevalence is 6 per 1000. One second. I guess I have put some wrong reading. Just a moment. Because there was so much of knowledge which I hope I am visible like this. Okay, so this was yes. So one second. Wait, insert, print out, video. And there was a movie in which Shah Rukh Khan was acting like an autistic person. Do you know the name of the movie? Right. Okay. Right. So it is now believed to be caused by a physical disorder of the brain. It is now believed to be caused by a physical disorder of the brain. And remember this important point, they have a limited capacity to communicate, socialize and learn. Right? Limited capacity to communicate, socialize and learn. Right? Remember, most of the kids have an IQ of less than 50. There was a one more medical condition in which the IQ is ranges from 25 to 50. Do you know? It's a common question also. Down syndrome. Even Down syndrome also the IQ is less than 50, 25 to 50. Right? Now, I have told you initially that they have a poor tongue coordination and that's why they pouch the food. They pouch the food and not swallow. They pouch the food and not chew. They try to put the food in the sulci and that's why they are very highly caries prone. That's why they are very much caries prone. These kids, they like sugary food too much. They like a good amount of sugary food, right? Which is soft, right? They also have strict routines, right? And they need multiple dental visits. And it's not like suppose I have a kid in the morning, she needed some restorations. He slightly acquainted the kid, told her what she is going to expect, and she was just roaming around. After 10-15 minutes, we again restarted the treatment, get it done. But for an autistic kid, it needs multiple appointment, multiple. Last year we treated one autistic kid, and all things were normal. We have used nitrous oxide, we have used even oral sedation, we have used takes some medical consent and all that. But yes, the thing was she needed 4 to 5 fillings, and it took around 3 sittings, which we generally do in 1 or 2 sitting. It took around 3 and 1 initial conservation sitting. So 4 sitting it took to go for 4 fillings. So that's a bit a challenge for us also. 30% of patients eventually develop epilepsy. 30%, right? Next question, quite controversial given in some books. A 10-year-old boy came to the dentist with a complicated crown fracture of 1-1 and 2-1. 1-1 and 1-2. One is central incisor, one is lateral incisor, right? Open apex with 1-2 with abscess formation. Vitality testing negative. What will the treatment plan for this kid? कोई बताएगा? Anyone want to guess? See, the thing is, many books has given this answer in which see 1-1 eruption around 6 to 7 years, root completion around 10.5 years, right? 9, 10, 10.5 years. Let's say 10. 1-2 eruption 7 to 8, root completion around 11 years. So here 1-1 root, we can say that it might be complete. Okay, let's say it's complete. But 1-2 is root is incomplete. So let's come to the options. Apexification of 1-2, RCT of 1-1, RCT of 1-1, RCT of 1-1, extraction of 1-1. So extraction तो हमें करना नहीं है, we have to go for RCT. So ultimately 1-1 is going for RCT, root canal treatment. The controversy comes with this 1-2, the root is not complete, and there is abscess. See, if it's a straightforward question, the answer is straightforward apexification. Some books or some few have given the answer as revascularization. Wrong. Revascularization is not a sure shot procedure. If the parent are willing, if the child is willing to go for multiple appointments, they want to try, fine. But revascularization is not 100% success thing. So, as the central root will be complete, it's a root canal treatment. Root of lateral will be incomplete, so apexification is justified. Revascularization can be tried, but it is not a definite sure shot treatment. Treatment plan बनाया गया है. हाँ, if they say that the child is okay for multiple visit, the child is cooperating for multiple visit, they want to go for natural closure, then you can try. It's not a 100% secure procedure. It needs 2 to 3 years of follow-up, and it is not always 100% successful procedure. पेडो में routine follow-up visit ही नहीं करते हैं, तो ये तो trial test, you can imagine that the child is going to come to the clinic or not, or to the department or not. So the apexification of 1-2 and RCT of 1-1. Clear cut answer. What is the given appliance and for what purpose it is given? कोई बताएगा? This appliance, it's a crib which helps in prevention of oral habit, which is one of the most common oral habit, digit sucking or thumb sucking. It's an age-dated concept, 0 to 4, nothing to do, wait and watch. 4 to 6, I've told in my multiple classes, 0 to 4, no treatment. 4 to 6, age-rated psychological plays and reward system. 6 to 12 or school age, reminder therapy or appliance therapy. It is not a removable thing, it's a fixed appliance for thumb sucking. They have put it as a functional appliance. They are not doing any functional means for tooth which is functional. It's not a functional appliance, it's a misnomer. They have put it as functional, it's fine. but this is basically a fixed appliance for digit sucking or thumb sucking, right? It's a palatal crib, right? They make the habit meaningless. How? What is the role or how does it act? By breaking the suction. जो थंब होती है उसको जो सक करने का जो प्रोसीजर है उसको ये ब्रेक करता है, make the habit non-pleasurable, right? It breaks the thumb and tongue pressure applying on maxillary incisor. So you might see that the tooth are forwarded, right? It forces the tongue backwards and distributes the force from posterior well. It acts as a reminder not to indulge in the habit. ठीक है, याद रखना, this appliance may result in immediate cessation of habit, but it should be worn for at least 6 months. It should be worn for कोई भी appliance होता है habit breaking, it should be there for 6 months. It's likely to be asked in the MCQ that what is MCQ in any appliance, if the habit is ceased, can we stop the wearing the appliance? No, it should be there for at least 6 months post correction of the habit. नहीं तो आदमी दोबारा उस चीज पे जा सकता है, ठीक है? Purpose of pulpotomy in young permanent tooth. Pulpotomy basically asking for apexogenesis. Pulpotomy in YPT. आपको बताया गया है what is young permanent tooth? Young permanent tooth is a tooth where the root is incomplete. For example, this is the central incisor, right? Enamel, dentine, this is the pulp. So the root is incomplete, which is known as young permanent tooth. क्या करेगा? To prevent infection, barrier, root fracture, it allows for a normal root closure. How does apexogenesis act in an immature teeth where the root is incomplete? It allows the pulp to function normally, like you can see this. आपने ओपन किया दांत को, आपने ड्रेसिंग दी यहाँ पे, ऊपर से आपने पक्की फिलिंग की, then what does it do? It creates an environment. This most commonly what we use MTA. Now what we'll do, it creates an environment which allows the pulp to function normal. And the role of the pulp is what? To form dentine and to complete the root closure, right? In apexification where you place the MTA onto the apex, create an artificial stop against which you can obturate. So it's a straightforward easy question, straightforward answer, right? Allow the root to form completely. Associated theory है, आप clean करोगे, partial you can go for young pulp, partial pulpotomy known as spec pulpotomy. You remove slight pulp to get more area against which you can restore the tooth, and you clean it with hypo and don't allow the clot to form. Bleeding should be stopped, clean with hypo and you apply the MTA. Exclusion criteria for SDF. Very easy question. SDF बहुत लोग यूज कर रहे हैं आजकल. Only disadvantage is it make the tooth black. हम routinely यूज करते हैं. It makes the tooth black. ठीक है. But इसके advantage क्या है? एक highly uncooperative child we use. Where the child is phobic for drill we can use. But the only thing we should be assured that the pulp is not involved. अगर pulp का थोड़ा भी doubt है, if there is little bit of doubt of pulp involvement, don't go for MD. Don't go for SDF. So there should be no history of spontaneous pain. Caries in dentine also you can apply, enamel also you can apply, and the child is incooperative. So we don't use it in a pulp inflamed. We don't use it in a pulpily inflamed. क्या बोल दिया अपन ने इसको? Tooth, pulpily inflamed tooth, right? कुछ associated part हैं. They might ask you what is the percentage of SDF? That is 38%. Am I audible? I hope I'm audible. No one is writing and watching, right? The percentage is 38%. How much of fluoride is there in SDF? 44,000 ppm. 44,000 ppm. Recognized by FDA in 2014 as a desensitizing agent. वहाँ भी you can use, right? वहाँ भी you can use, right? pH was asked. pH is 10 and it can be tinted or it can be colorless. मेरे पास जो है that is colorless, right? In relative analgesia question में they have tried to confuse you. Relative analgesia is basically conscious sedation. Minimum concentration of oxygen supplied with nitrous oxide. Basically क्या बोल रहा है, आपको मैंने बताया भी था, I told in class also, when we use nitrous oxide for conscious sedation, initially we supply for 3 to 5 minutes 100%, no Mamta, we don't extract, we have to save, right? We go for 100% oxygen for initial 3 to 5 minutes, ठीक है? Theoretically, right? Practically हम तो फटाफट. And then after 100% oxygen, let the respiratory tract clear of impurities. We start giving nitrous oxide in the increment of 10 to 15 or 20%. And slowly, sometime in the morning today, what I had to give a local anesthesia in a bit uncooperative kit. So my initial was 70% nitrous and 30% oxygen. And I cannot increase the nitrous more than 70%. I can increase the flow, but I cannot increase the concentration of nitrous for more than 70%. The machine that is known as a fail-safe mechanism. Class में बताया गया आपको. So minimum is 30%. If it is less than 30%, if it is going less than 30%, machine will not work. Sometimes what happens, if my oxygen cylinder is empty, the machine stops working. So I have to refill the oxygen cylinder. So minimum concentration, it should be at least 30%, right? And maintenance dose, that is, once I have given anesthesia at 50% or 70% nitrous, I basically commonly use nitrous then at the concentration of 70 to 30%. 70% is my maintenance dose of oxygen and 30% is maintenance dose of nitrous oxide. That's it. Right? It was also asked in the question in future, in upcoming question. A young patient has subluxation injury, which is the best treatment in such scenario. Subluxation injury. Subluxation means the tooth is mobile but at its own position, right? Treatment क्या करोगे? Splinting होती है इसमें 2 हफ्ते के लिए, but what is subluxation, right? Sensitive to percussion, increase mobility. Important thing is circular bleeding. It was asked in NEET exam, right? Circular bleeding. The teeth are not displaced. I told you initially also, right? Sometimes they did not respond to the pulse testing. The tooth is stunned and gradually it gains the supply of nerves and all that, right? Splinting vary from 1 to 2 weeks. Splinting vary for 1 to 2 weeks, right? All the splinting current time we use flexible or semi-rigid splinting. Flexible splinting for 2 weeks, flexible splinting for 2 weeks, right? Flexible splinting for 2 weeks. Okay. Only for pain relief and not for no. ठीक है? Pain relief के लिए तो हम उसको क्या देंगे? Can go for antibiotics or NSAIDs, right? And ये this is a bit, है ना? With no healing of pedodontium, it is something I guess wrongly recalled. Pedodontium की healing होती है, circular bleeding होती है, वो सब है. Splinting 2 हफ्ते के 2 weeks के लिए, ठीक है? और pain relief के लिए आप NSAIDs दोगे patient को. तो option A is correct. Primary teeth subluxation, no treatment, no splinting, only observation is done. Brushing with a soft brush and use of 0.5% chlorhexidine. याद रखना ये चीज. In primary teeth subluxation कुछ नहीं करना है. Splinting नहीं करनी है. Theoretically. What is this type of injury? Socket तोड़ के एक तरफ आ गए, एक socket intact होगा, एक alveolar bone intact होगी, एक alveolar bone टूट गई है. Right? What is this? Luxation. Subluxation में bone fracture नहीं होती है. Complicated में तो दांत टूटता है. Intrusion में दांत लग गया, बचा क्या? Lateral luxation. इसको क्लास में I have told you also. Displacement labially, lingually, distally or incisally. Like this. buccal side plate is alveolar bone is broken, right? Important thing जो dark में है, there is a high metallic sound on percussion, right? And PTS faces widening, best seen on eccentric or ocular exposure, right? ठीक है. But important thing is metallic sound on percussion, right? Splinting protocols. अगर टूल सबसेटेड है, थोड़ा सा ढीला है, 1 to 2 weeks. Extrusive luxation 2 weeks. Lateral luxation 4 weeks. 4 to 60-40 there have been laterally displaced, fracturing the alveolar process. तो ये सारे पॉइंट याद रखना. All can be asked as a MCQ. अगर आप इसको रिकॉर्ड कर रहे हैं और सिर्फ सुन रहे हैं, सिर्फ लिख नहीं रहे हैं, तो इसका स्क्रीनशॉट लेके अपने नोट्स में ऐड कर देना. Reincarnate without other complication 1 to 2 week. अगर गिर गया है लग्जेट होके ना, लेटरल लग्जेट होके हाथ नहीं आ गया तो लगा के वापस 1 to 2 week. ठीक है, ढीला है अगेन 1 to 2 week. एक्सक्लूसिव लक्सेशन, बाहर निकल के आ गया सॉकेट, अंदर डाल के वापस 2 week. लेटरल लग्जेट, अगर आपका बोन ब्रेक होके लग्जेट हुआ है तो 4 week. और अगर लेटरल डिस्प्लेस हुआ है, एल्वेलर प्रोसेस भी फ्रैक्चर हुआ है तो 4 to 6 week. ठीक है. बट अगर कुछ भी नहीं दे रखा है, अगर कुछ भी नहीं दे रखा है तो आप ये मान के चलिए कि आपको 2 to 4 weeks मार्क करना है. सिर्फ लैटरल लग्जेट क्लियर कर दे रखा है तो 2 to 4 weeks और स्ट्रेट फॉरवर्ड 4 weeks अगर सिर्फ 1 2 3 4 पूछते हैं. दैट्स इट. ठीक है. आगे मेंटेनेंस डोज बताया था, ये गलत है, ये सही है. 30% नाइट्रस एंड 70% ऑक्सीजन. Next है physiological transport media to avulse tooth which is not to be reimplanted immediately. Physiological media, बताओ इसका आंसर. Very easy. अगर ये पूछे that which is commonly available, तो फिर तो है आपका cold milk, cold, low fat. और अगर straight forward है, ideal पूछा गया है तो Viaspan is better than HBSS. थोड़ा बता देंगे HBSS के बारे में और थोड़ा इसके बारे में. ये basically Viaspan is made for pancreatic transportation, right? और Viaspan का pH 7.4, osmolality 320. It matches with the human body. That's why known as the most physiological storage media. Whereas HBSS, osmolality is same like a body 320, but the pH is 7.2, so slightly altered, right? So best is Viaspan, second is HBSS. HBSS का other नाम क्या है? Saber tooth और EMT, emergency media for transportation. And HBSS has a shelf life of 2 years. ये कुछ अलग से पॉइंट्स थे जो इसमें लिखे हुए नहीं है, बता रहा हूँ, so that if MCQ is asked you can mark. और ये क्वेश्चन मुझे आज दिया गया, कलर ऑफ ऑक्सीजन सिलेंडर. वेरी इजी, फोटोग्राफ है, देखो. व्हाइट शोल्डर, ब्लैक बॉडी. ऑप्शन है ब्लैक बॉडी, व्हाइट शोल्डर, राइट. और ये क्वेश्चन दे रखा है, ये ऑर्थो का था और आपके ऑर्थो क्लास में कवर किया गया भी है, शायद तक हम एक्सचेंज नहीं कर पाए. कंप्लीट पैलेट का क्लेफ्ट है, कौन सी में रिपेयर करोगे? 1 year में. ठीक है, 12 months. That's it. So there was nothing much which was not taught in your class. All the questions have been taught in your class and you can easily mark them. The only thing is in marking the answer right is your concept should be clear. आप जो notes बनाते हो, what notes we are making for your, आपको वो notes बना के उसको समझना भी है, समझ के उसको टेस्ट भी देना है. 2 महीने more than sufficient to correct the NEET. 2 months are more than sufficient, right? Test and analysis and redo. That's it. कुछ नहीं करना. कॉन्फिडेंस रखो, टेस्ट दो, मिस्टेक्स को एनालाइज करो, उसको थ्योरी से आपके नोट्स से पढ़ो. नोट्स में लगता है कम है तो आप अपना कोई भी गाइड बुक जो गाइड बुक किया, जो हमने बुक के नाम मेंशन करके अपने ग्रुप के अंदर, उसको यूज करो. सभी बुक की हमने सॉफ्ट कॉपी आपको आराम से कहीं भी मिल सकती है. बट जरूरत नहीं पड़ेगी उतना आगे तक जाने की. आप जस्ट टेस्ट एनालाइज उन टॉपिक को दोबारा से पढ़ के उन क्वेश्चंस के स्क्रीनशॉट लेके दोबारा से उसको रीअटेम्प्ट करो. अगर एक क्वेश्चन बारी बारी गलत है तो उस क्वेश्चन को अपने नोट में डाल दो और उसको आगे की तरफ बढ़ो. मेक श्योर यू आर गिविंग एटलीस्ट 2 ग्रैंड टेस्ट इन 1 वीक. राइट, डीवीटी और सीबीटी का आपको शेड्यूल दे दिया जाएगा. मोस्ट लाइकली हम जैन मिड में या जैन फर्स्ट वीक या दिसंबर एंड में हम डीवीटी और एक सीबीटी कंडक्ट करेंगे. राइट, इजी क्वेश्चंस. I hope you have marked all of them right, right? And let's prepare for the upcoming 2 months with full confidence, right? Thank you. Good night.